Welcome to the New You Show. On today's show, we're going to talk about health, beauty, and style. So stay with us. For today's health segment, we have Dr. Zayoud. Thanks for stopping by, Doctor.
I'm happy to be with you, Shireen.
Thank you. So we're going to call you Dr. Z for easy today.
Absolutely.
Right? Sounds good.
Absolutely.
So today we wanted to talk about what we're in, COVID-19. We're 5-6 months into the pandemic. It's crazy. How do we look right now? What do you think?
COVID-19 infection caught us all unprepared, unfortunately. When it started, we were so not ready. Basically, we were just using supportive therapy, IV fluids if the patient is dehydrated, Tylenol if there's any fever, and cough medicine. So we were kind of weak in front of the COVID infection. Nowadays, a few months after, we're much stronger, but we're still not perfect. We have remdesivir, which is an antiviral. It's good, but it's not perfect. We have the convalescent plasma, which is the antibodies that we get from people who got infected and got cured. That will help improve the clinical status, but it does not improve mortality. And recently we got dexamethasone, which is a corticosteroid. It's an anti-inflammatory used for asthma and COPD. Basically, it's an immunosuppressant. It does decrease mortality by a third in ICU patients. So we are more equipped, if you want to call it that way, to fight COVID-19.
And no need to panic. I get it now, right? No need to panic. In the beginning, we panicked. It was, like you said, it was new. We weren't prepared.
Panicking is never good.
Okay.
But we should not be, we should not take it easy.
Okay.
It's still not easy to deal with COVID-19. We still have many sick patients in the hospitals. We lost so many lives. We should not take it easy, seriously. We should be committed to practicing social distancing and wearing masks everywhere.
Okay. Okay. What about the second wave we're hearing about?
The second wave. So the jury is still out there. We don't have clear information about this. There is no clear definition for a second wave, really. Scientists are comparing COVID-19 infection to the Spanish flu that happened in 1918. Took so many lives, unfortunately. So the second wave could be a term that we're using for resurging, if you want to call it, or increased testing. Also, it could be increased infections, especially that schools are open now, people are socializing more. So we're not really clear about what's going to happen in the fall. But the UK now is experiencing a second wave, unfortunately. And they are actually short in test kits. Oh. So there is like real crisis in the UK about COVID-19 resurging right now. So if the UK is experiencing a second wave, unfortunately, and I'm sorry to say this, I think the US will experience a second wave.
Oh boy.
Too.
Oh boy. Let's talk about the schools now that kids are back to school.
It is child-specific, school-specific, and community-specific. So let's say if your child has sickle cell disease, which is a problem that will make COVID-19 more complicated, and you guys live in a community that's not taking proper precautions towards COVID-19, and he goes to a classroom that has 24 students. How do you feel about sending your son to that school?
I probably won't send him, that's for sure.
Absolutely, absolutely. But if you follow all the rules and you live in a good community that follows all the instructions about COVID-19 social distancing and wearing masks, if your son goes to a grade school where they have maybe like 8 students in a classroom, you would feel more comfortable maybe
Definitely.
to send your son to school. So it's really different, and it varies between each family and each kid in each community. So I'll leave that to you guys to decide, but it's not an easy question to answer.
It's not. Okay. What about vaccination?
Vaccination-wise, we have 4 countries basically competing to reach the vaccine first. We have the US, Germany, Russia, and China. Hopefully by the end of the year, we will have vaccination available in the US, but it's always challenging to predict how effective and safe that vaccination. So we just hope for the best, and when we get the vaccination ready, I think that will give us a great potential to go back to our normal life.
So we don't know whether that vaccination is going to have, or that vaccine is going to have side effects yet, right? We don't
Absolutely,
know,
because
it's new.
like, let's talk about the vaccination that came out from Russia. They didn't even do the phase 3, which is a very important phase that we cannot say anything about a vaccination if we don't do it. We still have not reached that point to talk about the safety and the concerns about the vaccination.
Okay. So we heard if you get the flu shot, you may not get the coronavirus that severely. You might have milder symptoms. Is that true?
Taking the flu shot is always advised. Sometimes some patients get infected with 2 viruses in the same time.
Oh boy.
And what happens, we call it an overlap syndrome, when a patient gets infected with the flu and with the coronavirus. So when you get vaccinated, you might decrease the severity of the disease and avoid having an overlap syndrome. So we should get vaccinated against the flu, definitely.
Sounds good. Let's all get it. Well, Dr. Z, it was a pleasure having you on the show.
Same here.
And be safe, please.
Thank you very much.
Thanks.